There are certain conditions or disorders which are caused by a mutation or a change in a single gene. Now, these genes are the instructions that tell our body on how to perform certain action or how to function. Some disorders in certain genes can cause a wide variety of symptoms. The examples include thalassemia, sickle cell anemia, cystic fibrosis, hemophilia, etc. Now, these disorders can be inherited either from one parent or both the parents who are carriers of this mutated gene. Sometimes it can also occur spontaneously, and this can result in a new mutation. With the help of a test called PGT-M, which stands for pre-implantation genetic testing for monogenic diseases, we can identify healthy embryos which are free from such disorders, and this can result in a healthy child. So hello, I'm Dr. Jwal Banker, and today we'll be discussing on what is PGT-M, who needs PGT-M, what are the common disorders which can be identified by this test, what is the process of PGT-M, what are the risks or limitations of the process, and what is the accuracy of this test. PGT-M stands for pre-implantation genetic testing for monogenic disease. It is a type of test which can identify the embryos who are affected with a certain genetic condition which the parents are carriers of, and the unhealthy or the affected embryos can be discarded and only healthy embryos can be transferred, and this can result in a healthy child in a pregnancy. PGT-M is for couples in whom there is a family history of a certain monogenic disease, and either one or both the parents are carriers of a certain mutation. It is not a blanket test which tells us whether this embryo is free of any disease, but it only identifies the mutation which either one or both the parents are carriers of, and that mutation has the risk of passing on to the child and can cause a certain disease. So only such disorders in which the parent, either one or both, are carriers of, that mutation can be identified in the embryo. So there are certain common disorders which can be identified by this test. Common examples include thalassemia, alpha thalassemia, beta thalassemia, hemophilia, cystic fibrosis, etc. And more than 300 such monogenic diseases can be tested in the embryo. Even some hereditary cancers, like cancers caused by BRCA1 mutation, if you are a carrier of this mutation, the embryo can be tested for such diseases. The process of PGT-M includes three parts. First is a pre-PGT-M mutation analysis. Second part includes IVF and embryo collection. And third part includes the testing. So before starting the IVF process, a pre-PGT-M workup is done. Blood sample is collected from both the parents, and in some cases even the parents of this couple, and even the affected child if they have a child in the family. All the blood samples are analyzed to pinpoint the exact mutation present and what are the possible combinations that can happen in the embryo. Once that is done, a specific probe which is specific to that mutation of the couple is made. Then we move on to IVF. In the process of IVF, the ovaries are stimulated to produce multiple eggs. These eggs are then fertilized using the husband's sperms, and the embryos are cultivated till a blastocyst stage. Once the embryos reach a blastocyst stage, a small biopsy is taken from the outer or a trophectoderm layer of these embryos. The embryos are then cryopreserved in the IVF center for future use, and these biopsies are sent for testing. Now, the third step is PGT-M testing. These embryos are then tested for that mutation against which that probe was made. Along with that, we can also do an additional test called PGT-A, which screens the embryo for certain chromosomal conditions. Now, based on this testing, we have a report which tells us which embryos are normal, which embryos are carriers, and which embryos are affected. So all normal and carrier embryos can be counted as unaffected embryos. Now we can proceed with the embryo transfer with this unaffected embryo. A rare case is of misdiagnosis in which the test fails to detect the mutation, and it can also happen by a condition which is called mosaicism, which means some cells in the embryo are affected and some cells are not affected. But the incidence of this happening is less than 1%, and this is a very, very accurate test. So if you are a couple who is having thalassemia and you have a risk of transmitting thalassemia major to your child, what is the next best thing available? You would either plan a routine pregnancy and do amniocentesis or chorionic villus biopsy when you are 3 or 4 months pregnant. If the child is found to be affected with certain condition like a thalassemia major, then you have to terminate the pregnancy. You can avoid so many of such terminations before even implanting the embryo back into the uterus. So to conclude, PGT-M is a very valuable test and it helps in detecting healthy embryos in couples who are at risk of transmitting certain monogenic disorders to their child. It increases the chances of having a healthy pregnancy and a healthy baby. And with the help of this test, you can avoid unnecessary miscarriages. If you have any doubts, please let me know, and thank you for watching.